and thank you for joining us. I'm Kendrick with the Texas Hospital Association. In my role, I am the VP for Quality Initiatives and Safety, and I am very pleased to be able to invite you to join us for a conversation with two of our member hospitals as they deal with the challenges and opportunities around vaccinating their staff for the COVID-19 pandemic. And with us today, we have from Hendrick Health in Abilene, we have Susan Greenwood, who is the VP of Safety and Quality. And from Houston Methodist, we have Jennifer Borders, who is the System Director for Wellness Services. And I want to welcome them both with us today and thank them for sharing their early learning and their preparation. So as we get started, the first question I think we want to ask is, anticipating the urgency and getting the vaccine out and available and into the arms of our staff, what pre-planning and infrastructure did you put in place prior to receiving the vaccine while we all awaited that all-important approval and distribution? And Jennifer, I'll start with you from Houston Methodist. What things did you put in place first, and how did you prepare for this opportunity?
Sure. Thank you for having me. I'm really happy to be here and excited to be able to share all of the things we're doing at Houston Methodist, as well as share some of the lessons learned and pre-planning as we know other hospitals are getting ready for their big launch. And I will tell you everything we have planned for as we've moved into this activation. We've had to change gears multiple times based on new information that's been provided to us. And what I'd like to share is kind of what we did when we initially learned that we were going to be receiving vaccine, and maybe some things we'll talk a little bit later about how we've kind of had to change gears. So one of the big things that we did at Houston Methodist was understanding our population. We have a little over 26,000 employees throughout the greater Houston area at 7 different hospitals, and we knew this was similar to how we handle our flu campaign and other types of things that we do where we have to mass vaccinate or we have to provide things to all of our employees. So the first thing that we needed to ensure we had prepared was a very streamlined, organized way to vaccinate our employees and have a comprehensive schedule to make sure that in this light of COVID, not only are we having to deal with the challenges of ensuring our employees are vaccinated, but dealing with the impacts of social distancing and not being able to have large lines and having people close together. So we use a system called Enterprise Health, which is our employee health portal. It's an occupational health EMR, and it has a self-scheduling model. So what we did was, our goal was to be able to safely administer as many vaccine as we could to our individuals. So we created templates within our employee health portal that would allow us to vaccinate roughly 2,100 employees a day. So we wanted to make sure that we had the infrastructure set to be able to start accepting those appointments when we were ready. So that was a piece. We partnered with our vendors. We partnered with we are the employee health team to make sure that we had that structure in place. The next big piece that we did was to ensure that we were inviting our employees in accordance with the rules and guidelines that were provided by the state and the federal government. So we took the guidelines that were provided and really took a deep dive into our employee population. And we put together a very detailed tiering process, prioritization process, and grouped all of our employees into tiers 1, 2, and 3. And then even within those tiering structures, we had a tier 1A, a tier 1B, a tier 1C, because at the time we were planning, we really didn't know how much vaccine allocation we were going to be given. And we wanted to make sure that not only did we have frontline caregivers, but within that, we had a breakdown of, okay, well, you're a frontline caregiver, but who are the frontline caregivers that are working directly in the COVID units? Who are the ones that are face-to-face with our dedicated COVID patients every single day and are at the most high risk? So we worked closely with a group of our medical directors focused on COVID, getting that prioritization and also working with the infrastructure on how then, when we were ready to start launching the invitations, did we have the structure in place to be able to accommodate. Also, with vaccinating 2,100 a day, you can imagine that takes a lot of space. You want to make sure that you've got appropriate space where people can socially distance. So at our flagship hospital, which is down in the medical center, we are vaccinating about 1,000 a day. And so we wanted to make sure that we had all the logistics when it comes to where are people arriving, how do they check in, how do they get in, and then after they get vaccinated, where are we keeping them to monitor them to ensure that post-vaccination they aren't having any reactions. The other structure we have been planning for is around our patient population. We've got to make sure that the IT infrastructure when it comes to our own medical record for patient population is set and designed to be able to document all of the vaccine administration. And then one other thing I will just share is that when we were getting ready for the arrival of the vaccine, we wanted to make sure we had our ducks in a row when it came to the truck arriving. What was our teams going to do when the truck arrived? What was the path we were going to take to get it to the ultra freezers that we had, the ultra low freezers? What were we going to do? We knew we had to turn off the temperature monitoring system. We had to put in place our own temperature monitoring. How were we going to handle the vaccine when we opened the cases? Moving it directly from the containers that they arrived in into our freezers, and then working through with pharmacy a dry run on how are we going to thaw, how are we going to transport to the locations we were actually vaccinating. So we did a couple of different dry runs at all of our facilities to make sure that we felt comfortable. So on the day when it arrived and it felt like Christmas morning when everybody was super excited that the vaccine was here, there was no question on what everybody's role was and what they needed to do to be able to have this vaccine quickly and safely go to the place where it was supposed to sit until we were ready to vaccinate. And then one other thing I will add is we were dedicated to being able and being ready. The moment that vaccine arrived on our premises, we were ready to start vaccinating once we had it thawed and once we had it ready to be reconstituted. So we had practiced and planned a soft opening just for that day. When we knew it was coming, we were going to have a soft opening, and we vaccinated about 200 people on that first day at just one location that was designed for us to practice and make sure that we had our workflows in place before the next day we launched it at all of our hospitals. So there was, I would say, extensive planning. There were a lot of things that we couldn't do until we actually got the EUA and we got the information from the manufacturer. So the weekend before was a lot of scrambling as, you know, all of us who were vaccinating immediately, we had to move quickly. I think the good thing now for hospitals that are still in that planning phase, you have the luxury of time. In a sense, it's still moving very, very quickly, but you do have the luxury of time to be able to work through some of these processes and learn from some of us that have kind of been there, done that, and have learned a better way or what we'd have done hindsight. But I would say those are some of the big key items that we work through.
Thank you, Jennifer. I think that one of the big takeaways I hear from what you're saying is the importance not only of the pre-planning, but of the practicing, the turning it into a drill and actually walking through that process beyond the paper and actually making sure that everybody understands exactly how this process is going to work. And we know how important drills are to other processes within our hospital, and applying that to this situation probably served you very, very well. So I thank you for that. Susan, can you share with us a little bit about what what Hendrick Health did in the pre-planning and setting up phase prior to receiving the vaccine?
Sure. And again, like Jennifer said, thank you for having me today. And I appreciate the opportunity to get to share what we did, and hopefully others can learn some. I won't reiterate things that Jennifer has already said. I would just say that the pre-planning involved was very multidisciplinary. And I know sometimes in our rural hospitals, people wear multiple hats. Just make sure when you're in that planning that you switch hat to hat, because it's not just a clinical issue giving the vaccinations. It is logistics, it's storage, It's security around where you're going to be giving the vaccine, securing it from night to night as you go day to day. And so we did planning every single day until we had our plan, and then we revisited until we finally were notified that we were getting the shipment. We got the shipment, it arrived one afternoon, and then we started vaccines the next morning. We're doing our vaccine clinic 7A to 7P. And the other thing I would say in terms of the pre-planning is sometimes resources are tight, particularly if you have a high COVID census, your resources are stretched. So think out of the box a little bit. We are very blessed to have access to Texas Tech University pharmacy students. And so our pharmacy group is reconstituting for us, and that allows then the nurses to give the vaccines. We have also reached out to other programs that have nursing students, et cetera, not necessarily to give the vaccines, but to help in other ways, the logistics, the signing in. And so just think about how to engage your community if you are struggling with resources to have this vaccine clinic. It is a little bit more labor intensive than giving the flu vaccine, just because of the paperwork. Jennifer's system had a nice way to make this electronic, and we would have done that if we had had just a little bit more time to do that, because there are a number of papers involved. There's information forms that they have to document that they read, to log it into the state MTRAC system. If your employee is not already registered, then there's a registration form for MTRAC. There's a CDC screening form. So it is a little bit more labor intensive. And then you obviously want to either, I think Jennifer is going to speak to electronically, but we're using the physical card that you fill out so they know that they've gotten vaccinated, which brand it is, and the date that they're to return for their vaccine, because you do have to make sure you have that follow-up, and that you also have the follow-up with the appropriate manufacturer. You can't switch in the middle of the stream. So the planning just involves thinking through all the things, what can go wrong. Spacing is a huge issue, because if you have two different locations for your after injection observation along with your vaccination, then you have to double your staff. And so if you have access to a location, even if you have to use the resources in your community to go off site, to have a large enough area to vaccine and observe, that's obviously ideal. Or, vaccinating people only while they're at work so that they can return to their department to be observed. Those are really your two options. And so thinking through the logistics of that. But again, include everyone that might be involved. In Lean, there's a nice methodology called SIPOC, and it's the suppliers and the input. And you think through who all might have a piece in this to make sure you have them around the table. And then if you're in a smaller hospital, just make sure you're changing your hats. You're thinking through all the ways this might impact you.
Very good, an excellent point. I really appreciate the comment you made about thinking outside the box about other partners and looking to your community. Some of those who will be viewing this recording will be from our smaller organizations, smaller hospitals in the rural areas, who their internal resources might be even more limited. And so considering who in the community can help support, even if it's like you say in the registration process or the paperwork process, or some of the having somebody be a runner, or however they set up their process, but to consider how they can look beyond their organization for those individuals who may be able to help, or great idea about using a community center perhaps for a location for giving the shots, so that you're not worried about confined spaces, because few hospitals have a large enough space to accommodate the social distancing required. So
Karen,
excellent.
Sorry, I left one thing out, and this is important, especially I would think as you have smaller groups of employees, something to plan through and think through, particularly while you're in the vaccination clinic, and that is managing your doses. So there is time that the vaccine from Pfizer has to stay in the freezer, or Moderna. in their cooling location. Then you have the thawing process. But once the Pfizer vaccine is reconstituted, it's good for 6 hours. And so you don't want to pre-reconstitute all your vials that you're going to anticipate using during your vaccination clinic, because it might expire before your clinic is even over. And then as the hours start to dwindle, you don't want to have vaccine, you have one more employee walk in and you mix a vial for them and there's no one else to vaccinate for the day and you have 5 more wasted doses. We are getting consistently 6 doses from our Pfizer vials, not just 5. And so if you don't do the appointment methodology, or even if you do and somebody doesn't show up for their appointment, think through how you're going to scramble and get more people in at the end of the vaccination time so that you don't waste those precious doses. That's something that we also planned through.
Very good, and an excellent point of how you're going to manage that, because it is a more complex process than what we are used to with the flu vaccine, for example. So as you both of your organizations put these processes that you worked on and planned and practiced, and you put them into place and you actually began vaccinating, I would suspect, like any good plan, everything doesn't go accordingly. And so there may have been some opportunities for some lessons learned. And Susan, since we've got you, we'll start with you and then we'll go to Jennifer. But what were some of the lessons learned so far? I know it's still early, but what are some things that you thought, whoops, well, that didn't quite work like we thought?
I would just say the one lesson learned, one we've changed kind of mid-course, and then one lesson learned. We started with a vaccination clinic outside the building, and then we had an observation site just adjacent to it. And we realized after the first day of vaccination, well, actually very early into the day, that we wanted to move to a different location so that we could have all of it together. So now you walk in, you check in, you go into a very large room. Vaccinations are on one side of the room, and then on the other side, we have chairs set up 6 feet distanced, and that's where you do your observation, but it's all in one large room so that we could conserve our staff. The second thing was we debated over and over how to arrange for staff to come. And as Jennifer mentioned, we went through the prioritization schedule of frontline staff and those key support areas like phlebotomy, et cetera. So how to get them in a seamless manner to not overwhelm the vaccination clinic, but to not underwhelm and have thawed, vials that we weren't using. Also, the issue with, especially on the second dose, we're hearing the stories that they might need to be prepared to call into work for a day or two because of the side effects. And so how to space that out. We thought about appointments, and anyway, we thought about a lot of different things, but on the first day, we set up our blocks based on the last name, first initial of the last name. And we thought just randomizing like that we went through half the alphabet on Friday and the other half on Monday. And we thought that would create enough spacing to allow for that illness. Going into Friday, though, we got some feedback from the state that we needed to go ahead and get the vaccines done to keep that pipeline going. And so we opened our clinic on Saturday, and we realized that we could handle the volume for our organization. So we stopped the alphabet and we just said it's open 7 to 7. We just kind of regrouped in the middle. It's not anything we did wrong. It just seemed to, once we got going, it wasn't that necessary.
Right. Yeah, if there's one thing we know in healthcare is we've got to be flexible and react to the situation on the ground at the moment. So well done there. Jennifer, so talk a little bit about some of the lessons learned, or maybe the alteration to plans that you experienced in Houston.
Sure. So I will tell you, if there's one thing you take away from this call, is whatever plan you put together, don't plan on that being your final plan. Plan to pivot and to move. we are only and all making the best decisions with the information we have at that moment in time. And as you all know, the information that we're getting from many different sources is changing quickly. And so I think as long as you're prepared and you are ready to adapt and be flexible, you're going to be successful. You're not going to make the right decisions every single time, and nobody expects you to. And so I think we can always put a plan together that we think is going to be the right plan, but we all know that things are evolving. This is just a constantly evolving process. And as long as you're comfortable knowing that this is not the final thing, you're going to be golden. And so that's kind of been our MO around here is, okay, what new information do we have? And is what we have in place the best solution and the best plan? And so I kind of have a list of things that we've either already made changes on or planning to make changes on based on information that we've received. And so as of yesterday, we vaccinated about 8,000 people so far. And today we opened our doors for first responders in the community. So we invited on late Friday about 4,000 first responders in the greater Houston area, fire departments, EMS groups, and others that don't have access where they are. And so we wanted to make sure that we had a home for them to come get there and receive their vaccine. And so I have a list of things just to share, and this really applies in a large mass vaccination scenario. One of the things that we didn't necessarily plan for, because we have scheduled appointments at our largest location, we are vaccinating, like I said, a little over 1,000 a day, and we do have appointments set at 5-minute slots. So in essence, we have 12 people coming in every 5 minutes to receive their shot. So with that type of throughput, you've got to be streamlined. You've got to have everything in place. And so what we learned very quickly is, and this is no different for our employee population any other time, is that we did have a lot of people just showing up as walk-ins and saying, oh, well, I'm scheduled tomorrow, but can I just get it today? And no, the answer is no. We have a process in place to be able to get everybody through based on their prioritization, but then also in the safest way we can. And so one thing that we did put in place after that first day was, what we're calling our crowd control. So we do have volunteers that are stationed outside of the space, making sure that the people who are in the socially distanced line actually have that appointment for today. Do they have their consent signed electronically? And are they supposed to be there? We have a lot of people showing up who are, their appointment may be at noon and it's 8 o'clock. And they're saying, well, I was just kind of hoping I could get in right now. And that's kind of a hard line that we've taken, is saying, no, we want to do this safely. We want to do it fairly. And so, us in healthcare, we always want to be accommodating, and we always want to try to take care of those doctors and nurses who are having to be back at their workspaces. But we've kind of taken a hard line and putting in those crowd control folks who are helping us make sure that we're not having those walk-ins. When you have walk-ins on a scheduled appointment, it does require a lot of extra work at the folks who are checking them in. And so we've got to keep that throughput with the high volume we're doing. So I would say if you're planning on mass vaccination programs, make sure you take into account and plan for people who are just going to show up. And you need a plan, and you need to have people to manage them so that they understand why we're doing things this way. It's not because we don't want to take care of them. It's really because we're trying to push that throughput. The other thing Susan mentioned, when we started vaccinating on the Wednesday for our mass vaccination program, we learned about halfway through. We also have pharmacy partnering with us on site where they are reconstituting the drug. And then we have a check-in, check-out process with the nurse. So we've got 12 stations at our largest site with all of our nurses. When they complete a vial, they turn it back into pharmacy. Pharmacy gives them a new vial. And what we learned about midday, same thing, Susan, that you guys mentioned, is that we can get more than 5 doses out of the vial. And when our pharmacy noticed how much overfill was in there, they called the manufacturer immediately and said, hey, can we use this? Because this is a lot of waste, and we want to make sure that we're utilizing it. And the manufacturer, Pfizer, said, absolutely. If it's there, it's diluted equally. There is no safety precaution or reason why you can't. And so we we pivoted very quickly to be able to start getting 6 doses out of the vial. One of the things that I just heard this morning, hot off the press, I went down to our vaccination site, and what I did hear this morning is that we're already starting to get a different lot number in because we've pushed through so much vaccine. The supplies we're getting are a little bit different than the first round that we received, and we're not getting as much overfill out of the next lot. And so our pharmacy is doing a little bit of homework and testing right now to say, is it because the syringes are different? Is it because the vials are not filled the same way? So they're doing a lot of homework right now to try to figure out what's going on with that. But it's important to just be mindful of that. If you can get those 6 doses out, please do, because we certainly do not want that to go to waste. Another big change that we put in place after the second day is at our largest site again, we have a big open space to where we are instructing our employees, if you've been vaccinated and you don't fall into these risk categories, you sit here for 15 minutes and we're going to monitor you, and then you can go back to work. If you fall into those higher risk categories, you have to sit for the 30 minutes. Our CEO had contacted a couple other hospitals around the state of Texas and was just asking, like, what are y'all doing for these large sites with monitoring? Because we've got so many people in here. They were socially distanced, everything was good, but it was, it was a lot of space. And so one of the things that we learned, just again, lesson learned from calling another hospital, was for clinical folks who were going back to a clinical area, where in a nursing unit or a clinical department, what they were doing was keeping them 5 minutes if they fell into that 15-minute observation time, keeping them 5 minutes, and as long as they were going back to a clinical unit where there were physicians and nurses and other clinical folks, that they didn't have to stay the full 15 minutes. They could stay 5, we did a check off, and then we sent them back to their units. And so what that did, when we moved to that, it opened up our observation area. It wasn't as compressed. And anybody who was not going back to a clinical unit obviously stayed their full 15 minutes, but it did allow us to have a little bit more capacity and space in those high volume areas. Another lessons learned, or I guess one thing we've changed, is the workflows that we put in place. I would say in a normal, everyday new rollout of something, we would typically have high IT support for first day, second day, first week type of activity. We had some new IT processes, some new ways of doing things specific to this vaccine on the technology side. And I don't think that we anticipated the amount of clinical IT support that the team needed. And so I would, if we could go back and do it all over again, I think one thing we would do is make sure that we had more sustainable long-term IT support on site the first week to be able to give the nurses and those who are administering vaccine a little bit more support. So we put that all in place now, but it's one of those things, hindsight's 2020, you're doing the best you can with what you have. We would certainly look at doing that differently. The other thing, I would say the kind of the last thing that I've noted here, we're also in our planning phases to look at how do we distribute the vaccine to the patients and to our outpatients and to the community. And initially, before we kind of even kicked off our employee population, we had planned to identify specific same-day clinics within our physicians organization to vaccinate. And the more we've learned about the inventory control, how important to have zero waste is with the vaccine, and being able to manage some of the reactions that we're seeing, we've kind of changed gears even this weekend and said, well, instead of having a lot of little sites, maybe the direction we should go into is having fewer larger scale sites. That way we have a little bit more control on our inventory, we have a little bit more control on managing reactions. And I mean, you guys know, even though it's a larger site, you have more controls in place when you reduce the number of variables that you kind of throw in. So that's one thing that we're actively planning right now to say, this is not what we intended, but this is where we're moving based on what we've learned over the past, 5 to 6 days of vaccinating.
Thank you for that. And one of the interesting things about this whole process, I think, is that in a way, this whole process of vaccinating our staff in our hospitals over whom we have some control. Certainly we have more control than we do the general public, our patient population in the community. And so some of the lessons learned from our processes with our staff will help to inform how we set up to address the public. And I think that that's a really, really important takeaway. And I certainly appreciate your comments, Jennifer, about needing to be flexible and understanding that even the best laid plans, especially in something as unique as the situation we find ourselves in, is going to require flexibility, and we have to be on our toes. So I know, Susan, you had mentioned when you were speaking a while ago, you mentioned how you had started out randomizing your staff by the alphabet, according to their last name, to kind of stagger so that everyone on one particular unit, for instance, didn't have a fever on the same day in the reaction to the vaccine. And we know that that's not as likely with the first dose, but it'll be more likely with the second dose that a few more people may have some sort of a systemic reaction. So something to consider. So how are you guys planning for that, Susan? How are you anticipating the need to stagger, particularly on that second dose, so that you don't have particular nursing units or shifts or disciplines that are suddenly short-staffed due to a reaction, systemic reaction to the vaccine?
Sure, that's a good question. And we had thought initially that the alphabet per department would help with that. And but we also met with and visited with the nursing directors from the clinical areas that are being vaccinated, as well as the physician leadership. And in those critical, the COVID units or ICU, they are just staggering their employees. And like I said, we did vaccination clinic Friday, Saturday, and then today through Wednesday. So we're just staggering over the next 5 days, and they are helping to control that as well. So we didn't send out an email that the alphabet plan had gone away. So some were still following that, but we just we were not turning people away. If it wasn't the hour for the B's or the D's or the F's, we weren't turning people away. So we have some staggering going on there, but then we also communicated to the leaders in the department to be talking with their staff. And I know we'll talk about it in a minute, but just communication with staff. There are very good questions out there, some concerns. It's not so much, I don't want a shot, I don't want a needle. They've watched TV and they've read articles and they had concerns. So we had to do a lot of messaging with our employees and then also with our community.
Yeah, and that messaging is extremely important, and we will spend some time on that here in a minute. Jennifer, as you guys, I know it's interesting that the different approaches, and both are good, valid approaches. And I know you said that given the large number of folks you guys are trying to move through, Jennifer, that you took a harder stance than perhaps Hendrick had to do in Abilene, as far as, no, this is not your appointment time. You come back when you're supposed to be here. But how did you think through those appointments in relation to the potential for an adverse reaction?
We had a lot of discussion around that topic because it's real. It's a real concern to say, are we going to have a whole department go down? And what are we going to do in the event that happens? And I will tell you, we probably discussed that topic for well over a week with what are the consequences? What are the pros of pulling out and assigning people appointments versus having them self-schedule? And again, we are doing a self-scheduling process. And so ultimately, when we really sat down and thought through the complexities and the logistics that it would take in order to take 26,000 people and assign them a slot, it was near impossible to be able to do that. And so all of the literature that our scientific group, we had a scientific committee that was comprised of some key physicians and some of our key scientists in our research institute. And we had them really come look at all of the data that was coming out and really showing what were the side effects, what could they be, what are the things that we could do to try to mitigate. And after their review, we decided that we weren't going to go through and assign people based on what shift they worked or what department they worked. We said, we can't do that. It's just too many people. So we said, you know, we're going to move forward with our plan to allow self-scheduling based on the prioritization that people fall in. And I'll tell you, we've been vaccinating now since Tuesday with our slow opening, and we really have not seen an impact to any department. The staff, I think we've got a good mix of staff where you've got those eager beavers who are ready to get out there and get their vaccination on day one. You've got some who are saying, you know what, I'm going to go in week 2 when I watch my coworkers do it and I want to see what they're doing. And then you have some that are like, I'm going to hang back and I'm going to wait. So I think we've not seen, you know, everybody kind of rushing the site all at one time to be able to get on. And we've been lucky up until this point that it hasn't taken a toll on our departments.
Okay. And there may be, for the second dose, maybe some extra consideration. Have you thought about that?
We have, and you know, what we're doing is talking a lot. We've created a ton of FAQs and a lot of information that has been going out to employees now for a couple of months, actually, talking about the technology of the vaccine. What are the common side effects? What are the common symptoms? What are the things that are normal, right? So people have this heightened awareness of, oh my gosh, you know, I feel a little this way. Well, you know, that's normal. We see a lot of normal reactions even after the flu shot every single year, but we don't hear about that, right? I think it's because of the heightened publicity and excitement of this vaccine. So we're trying our best to really educate the staff on what is normal, what is not normal, when should you report, when should you not report, what is something that is an emergency versus a normal side effect that, and we're allowing folks when they leave our vaccination station, we have Tylenol available, and the nurse is educating each person. Hey, you are, you know, some of the common side effects that you may see over the next day are da 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 da. Here is some Tylenol. In the event that you start feeling these things, please go ahead and take it. So we're trying to educate the staff and let them know that some of these side effects are normal and it's okay, but it shouldn't keep you out of work, right? Only these things are the things that should keep you out of work if you're feeling really crummy and terrible. So we're trying to do our best on educating folks to be mindful of their own bodies, understand what's happening with them so that they can take kind of the right path, whatever that may be for their situation.
Very good. So while we have you on the screen, Jennifer, we'll pivot to what Susan already alluded to and talk a little bit about the concerns that many have about the vaccine. You know, there's a lot out there. Some of it valid information, and some of it we know is disinformation, but it's out there. Social media is running rampant, and there are always those things you hear that have just enough of a ring of truth that makes you wonder. So I know you said you've put out a lot of information about side effects and that kind of thing, but what have you done? Because hospitals, we certainly want all our staff to be vaccinated. We want all of our staff to be safe and protected. But at the same time, we respect the individual's right to make that decision about their own health and whether or not they receive the vaccine. But it's just like with our patients, we want to make sure they have all the information they need to make a good decision for themselves and their families. So tell us a little bit about what you've done there to help staff with that anxiety related to the vaccine.
Sure. So we anticipated a lot of pushback or questions or just general curiosity about the vaccine. And we actually started a series. Our chief medical officer sends out a weekly update to all employees with key information related to COVID, not just the vaccine, but what's happening with COVID, how many patients we have in the hospital, what's happening. And so we started a series close to 2 months ago where we started talking about the vaccine, because we knew the earlier we could get ahead and get people comfortable with some of these concepts. And every week it was a new topic. What is mRNA technology? What are the anticipated side effects? And, you know, some of the stuff even debunking what is in the media right now. No, there's no microchips in this vaccine. And, you know, just all sorts of things that people are hearing and really trying to bring some truth and answering those questions. And in those weekly emails, it wasn't, you know, an extensive document. It was one question for the week. So it was little bits of information that provided clear facts and education. So we've had that constant communication now for, you know, two months prior to the vaccine. The other thing that we've done is we have identified formal and informal leaders throughout the organization in some of the high-risk areas to be able to follow them. So when they got their vaccine, we had our internal marketing and PR teams down there filming and taking pictures of them getting their vaccine, and then also having a quick conversation with them afterwards. You know, how do you feel? What is it like? Are you excited? And so we've been taking all of those videos and photographs and comments and messages and including them in a lot of the employee communications that are going out and having them be the advocate. And so it's not administration and leadership that is actually pushing, saying you should do this. It's their own peers and their informal leaders within the organization. And so that has been amazingly successful, because a lot of people who have been hesitant to come forward have said, oh, well, my buddy nurse that works alongside with me, or my charge nurse, or someone else got it, and they seem to be okay, and they're really happy about getting it, so maybe it's okay for me. And so, you know, you can only educate people so much, right? You can only throw facts and information at them. But when you see your coworkers, someone who you trust, someone who you respect, is getting the vaccine and is okay and is advocating for it, that goes a lot further than just putting out an FAQ or putting out a you should do this because. And so we've leveraged that a lot. We've got some really cool photographs of our chair in chief over our intensive care units. He's got a picture of himself with two of the other ICU doctors that are holding their arms like this with the Band-Aids on it, you know, and really publishing and pushing that out. And it's going to take a village to get everybody comfortable with this, but if we do more advocating and showing rather than telling, I think that's where we're going to see success.
Well, I think that is a very profound statement you just made, that we do more showing than we do telling, and because people are you know, they're being shouted at information, whether it's accurate or inaccurate. I feel like information is just being shouted at us from all corners, and so that demonstration is powerful. Susan, I know that at Hendrick you all have been doing some work to help make sure that your staff are well informed. Can you talk a little bit about that?
Sure. There's basically three different things that have happened. One, we have in our marketing department, we have a very talented group that does video, and that seems to resonate with our staff, where they can hear and see someone. And so we did some video education from our CMO, our physician leaders, different medical directors on answering the questions about the vaccine. Like Jennifer said, what is the messenger RNA? How does it work in the body? Why was this so rapid a vaccine versus others? And trying to alleviate fears. And we put those videos up on our intranet. And then we've also done some emails from our chief medical officer. He has a newsletter that goes out. And so he has, it's called Ask Rob. And so he's put out small pieces of information. And then there's a link where physicians and staff can ask questions back. So we started that early on. Then we had a meeting with the city, our local public health department, our city manager, the mayor, and we wanted to make sure that we had a prioritization plan for our community, not just in the hospital. Who was going to be vaccinated, what were going to be some lessons learned, how are we going to plan logistics for the community. And one of the pieces that was mentioned in that is our mayor and our city manager asked us to create some messaging when we started our vaccination clinic for the community, so that when the education went out, when it was time for the community to be vaccinated, that it wasn't the city manager or the mayor saying, you need to get vaccinated, that it truly was medical professionals getting the vaccine and saying, this is safe, and this is the reason it's safe, and this is the reason I'm choosing to get vaccinated. So the morning that our vaccination clinic opened, we had several of those key physicians planned for the first injection. There was media, there was local coverage. The mayor was there, our CEO was there, just to support those high-risk providers as they started this vaccination journey. And so our marketing department is working on various pieces of information that can go out to the community, and that has already started on our social media websites. And then, you know, like Jennifer said, just the stories back from the staff to each other, and asking those questions as the vaccination clinic got ready to roll out. Are you going to be vaccinated? And if not, why? And we're not judging, we're not telling you that it's mandatory, but we want to help answer those questions if you still have questions. And so we've been out asking those questions and then trying to come back at it multimodal, from videos to emails to different information, so that our staff can make an educated decision. We just want them to be informed, and we want it to be an educated decision. And so that's our goal, is to really answer all the questions that are out there.
Excellent. And you were so good about leading into the next question, but I think Jennifer wants to say something.
Yeah, I just wanted to add one other thing that popped in my head when I was listening to you talk. Again, when we say show me, don't tell me, right? We created selfie stations outside of all of our vaccination areas. And so our marketing department put these really cool big selfie stickers on the walls, and it says, you know, I got my COVID vaccine, and there's a spot where you stand in front of it and you can take your selfie. And so when you look at nowadays, like LinkedIn, or you look at even our Houston Methodist Facebook page, there's just tons of employees that are posting those pictures of themselves in front of our selfie stations. And, you know, when we were planning all this, our marketing department, they're like, oh, we're going to put selfie stations. And I kind of thought, okay, like, we're trying to push all these people through here, you know, do we have space for selfie stations? And I'll tell you, it has been really successful. People love it. They leave the vaccination area and they're like, well, wait, where's the selfie station? I got to get a picture. I got to get a picture. So they're sharing it with all their friends. They're sharing it with their coworkers. And it's been a phenomenal, phenomenal turnout. And so, you know, if you have the ability to create something like that in your organization, to where you can create some hype and excitement and really share with others, I would encourage you to do so, because it's been very successful here.
What a great idea, and how fun is that? And it also speaks to the importance of, you know, sometimes when we approach a process such as a vaccination clinic, we think very clinically, but making sure we have all potential partners at the table as we're making our plans. And so to have marketing there, to have communications there, and these various other groups, because they bring a whole different perspective that we might not have thought of as we have on our nurse or our physician hat, thinking about a vaccination clinic. So excellent, excellent point.
Yeah, it's not often that you see large groups of people with Band-Aids that are excited.
Yes.
You know, so many people are excited to have a Band-Aid on their arm. So it's just a different type of scenario at different times. It's really cool to see.
Yeah, well, I will tell you, I'm looking forward to when I get my Band-Aid. So I want to go back to this, the idea of the community, because Susan led us into that, which is really my next question. Because when I think about how we communicate with the community we serve, I'm thinking of it from this vaccine perspective in 3 different points. And, you know, one is we want our community to know what we're doing to ensure that their healthcare providers are going to be there when they need them, right? That we're vaccinating our staff, and we're doing that so that we are here for you. And then secondly, we're also setting an example that this is safe. This is the right thing to do. We can all do this. And then third, which you may already have people knocking on your doors asking you, is when's it their turn? And what's the plan, and how are we going to address our community needs? And so Susan, you began talking about that a little bit when you talked about the pre-planning you did with your community leaders, and how that, you know, you were thinking several steps down the line about how that was going to roll out. So can you share a little bit about how you're communicating with your community as you move through this process?
Sure. So a couple of different fronts. One, we have a liaison in the region, and he is fielding questions from other communities around us, smaller communities, and the hospitals in that area. And so we are helping to get the information out because we want as many eligible locations to register to give the vaccine as possible. And I know that's not what the point of today's call is about, but we're truly trying to resend those links, resend that information so that everyone can get registered and be potentially on the list. That's critically important. The second thing is that we are talking with public health and with our city on how to roll out according to the prioritization phases that the state has given us. And so as we are giving vaccines to our high-risk population and then looking down that list, tomorrow we're keeping a count on the vaccines that we've given so far. And then tomorrow at noon, we plan to huddle up with our chief medical officer and start to address additional organizations or providers that might be available. And like Jennifer said, they've already reached out to EMS. We plan to do that tomorrow based on our number of vaccines, but it will be done in a very methodical manner with others having input so that we are prioritizing as a community those high-risk providers. Excellent.
And I think that visibility is so important for a community, for your community to see what you're doing and how you're doing, so that they are assured, because as hospitals, you are the hub of healthcare for your community, and people look to hospitals for that direction for the health of the community. So I think that's critically important, and I applaud you for partnering with your community leaders so early in the process. Jennifer, what are some things that you all are doing, and how are you communicating with the greater community?
Sure. So we've done a lot of the exact same things that Susan described. And like I said, we started vaccinating some of our first responders today throughout our system. So we were really excited to be able to offer that up and allow them to come in to be a part of the Houston Methodist family and to, you know, get a part of that selfie station. We definitely want them to feel good about getting the vaccine and us being a partner to them. We also have done quite a bit of communications to the general public to let them know what we're doing. So I mentioned earlier in one of the earlier questions that we did a lot of dry runs and a lot of practices with the processes. Many of the general public, they don't understand how much work and planning goes into this, right? And so what we wanted them to know that we're not going to do things the easy way. We're going to do it the right way. We're going to do it the way that is going to ensure the utmost safety to our patients. So as we went through all of those dry runs, we had our media PR folks come and record and do B-roll film, and then we were putting together really short narrated videos that we would push out through social media to the community to say, hey, we're getting ready. This is what we're doing to make sure that it is safe. These are the things that we are doing to make sure we are ready for you. And so we published kind of a different series, whether it's the logistics on how we're going to receive the vaccine. We had one short snippet one on, you know, what is mRNA technology, all very small snippets, right? So not anything overwhelming. It's just very high level to help the community understand that we are taking this seriously and we're getting ready. Just like we communicated to our employees on a lot of the FAQs and helping them get ready, we've been doing the exact same things to our patients. So we utilize a lot of two-way communication portals with our patients and our physicians organization, and have been sending out a lot of messages about, you know, what is mRNA technology? When are we going to be ready for you? We have had an overwhelming amount of patients calling us saying, when's it my turn? When's it my turn? And so, you know, we've pushed out a lot of messages saying, in a very nice way, not like this, don't call us, we'll call you, but this is what we're doing to be ready for you. And so we're doing a lot of proactive communication to let them know, like, in the next couple of weeks, we're going to be ready, and this is what we're doing. So we also utilize a lot of internal population health analytics software to where we've been able to go through and prioritize our patient population based on the criteria that's been given to us by the CDC and the federal government. So how those patients are prioritized, we'll be notifying them, hey, you know what, it's your turn, and these are the locations that you can go to and schedule your appointment. So with hundreds of thousands of patients, you've got to have a very seamless, organized, automated system, an electronic system, because we can't have a call center answering phones every day. We've got to have a very systematic approach. And we've been in direct communication with our patients, letting them know where we are in the process and when it's going to be their turn. We have a lot of patients and a lot of people in the community that are ready, but just like our employee population, we have patients that aren't quite ready yet, and that's okay. And we're going to continue to give them the facts and the information, and hopefully when they're ready, we'll be here waiting for them.
Very good. I heard one organization or one individual compare this to the safety message we hear on the airplane. If you're traveling with a small child, put your oxygen mask on first and then help the child. And it's not that we're saying the general public or children. What we're saying is we've got to take care of ourselves so that we're able to and there to take care of you. And to get that message out to them, I think is really, really important. And one of the things that certainly you mentioned, Jennifer, and Susan also, is, when you're working with large numbers and you're a large organization, you also have access perhaps to more resources than some of our smaller facilities. They might be working with smaller numbers of staff and public, but they have smaller numbers of resources to do that too, and to be flexible in how they approach the process, and thinking outside the box to come up with different ideas and different ways that they can utilize folks, maybe in a way they're not usually utilized, utilizing those nursing students or those pharmacy students or others. There are people in the social work and case management that are excellent at managing processes and paperwork and that type of thing. So what can they do, and how can we get all the right people at the table to have this conversation? So much to take away from what you have both shared today. But before we wrap up, I wonder, is there anything else, any final words or words of encouragement or maybe caution that you would want to share with the audience, and let them hear from you, from your experience? Jennifer, we'll start with you, and then we'll go to Susan.
Yeah, I will say, I've been in healthcare now for about 17 years, and I don't think any of us have ever seen anything like this. And again, I'm just going to go back to, it's not going to be perfect, and you have to be okay with that. And as long as you're okay with that, and you know that you're doing the best you can with the information you have, and you have the ability to pivot and to mobilize a different direction when need to be, then you're doing a great job. We have changed directions on so many different things. Some things, large changes, other things, just very minor tweaks. And that's okay. It's just not going to be perfect. And when you think about the scale and the scope and the what we're trying to accomplish, I mean, it's historic. And I think everybody who's involved in this process has to be really proud to be a part of such an amazing endeavor. And it's going to be okay. It's really exciting. I mean, it was really funny when we were down in the dock the day that the vaccine came. I had this overwhelming feeling just of excitement, and it was odd, because I was like, I've never been so excited to see a box of drugs come off of a truck before, but it was just monumental. It's like, what are we about to do? And it's amazing. And so I just want to encourage everybody, you're going to have days that are not going to be good days. You're going to have days that you think you've never done, you haven't done things right. You're all doing the right things. We just have to be flexible and to mobilize and to be adaptable, because nothing is going to be perfect. And I just want you to know it's it's just the way it is. We live in this world. 2020 has been an interesting year altogether, and what a way to top the end of the year off with being able to offer everybody this vaccine. But just know everybody's going to do a great job no matter what your plan, how you're moving forward, you're going to do a great job.
Excellent. Great words of encouragement. Certainly appreciate that, Jennifer. Susan, last thoughts?
Sure. I want to echo what Jennifer said. The morning of the vaccination clinic, it's a feeling like you certainly don't have a giving flu shots or TB skin tests or anything like that. It was emotional to see those frontline physicians and staff that have just day in and day out put their health and safety at risk to care for our community in this COVID pandemic, coming through and receiving kind of what we feel like is the light at the end of the tunnel. It was an amazing time. I think as you start your planning to give your vaccinations, think through what are the key things that we have to manage. And like Jennifer said, you're going to always having to be switching things up, and maybe things aren't going to be perfect, and that's fine, but there are a few key things that you have to address. One is the management of the vaccine itself and the timing of the freezing, the thawing, and the reconstituting. So have a plan to manage that vaccine so that you don't have wastage. The second thing is the potential for side effects. We have vaccinated about 1,500 employees and physicians to date, and we've had just a few minor symptoms, a little tickly throat, and one woman thought she was having a little bit of chest pain, realized it was probably anxiety. But you need to have resources there and treatment available for those employees if they were to react. And then the third thing is that follow-up, making sure that you're tracking that employee, whether it's electronic or whether it's just a old-fashioned Excel spreadsheet, if you have to do that, but the date they got vaccinated, what the manufacturer was, and what is their due date, because you cannot cross your manufacturers, and each of them so far, Pfizer and Moderna, have a different revaccination time frame. And so you need to be sure to keep up with that. So if you do three things very well, you need to manage your vaccines, manage your side effects, and manage your follow-up. Everything else you can roll with the punches and just get in there and do it. And I'm available afterwards. We're certainly not the experts, but possibly we're going to be a week or two ahead of anyone else. And so if we can share anything, there are resources. If you don't have a marketing department, if you don't have a videographer in your hospital, there's some YouTube discussions from some very smart physicians that were involved in the vaccination development, explaining messenger RNA. YouTube is free. Send your employees out there to watch. So there's some things that you can do, even if you don't have the resources in your hospital, to provide that same level of education. And the hospitals in Texas network well, and I know we're willing to share anything or let you borrow any marketing pieces. So just use your resources. If you don't have them in your hospital, reach out to others.
Excellent, Susan, and thank you for your generosity. I know that the Texas Hospital Association, we have, of course, our COVID-19 resource page with a number of resources there. At the same time, we also really enjoy being able to make connections. And so if anyone listening to this recording would like to be connected with someone who perhaps is ahead of them in this process, to ask some questions or to get some ideas from, we'd be happy to make those connections for you and make sure that we all learn from each other. This is a historic time. It's nothing like this has ever been done before. I can only imagine what the literature is going to look like a year from now. With a lot of amazing lessons learned that who knows what we can apply it to. So it's a great opportunity for healthcare in general and for individual professions. But at the same time, we're living through a little bit of the unknown. And so being able to walk through it together and learn from each other is absolutely critical. So I want to thank you both for taking time, anyone listening to this. We're actually recording this on a Monday morning, which is a challenging time in most workplaces, but certainly a Monday morning, the first Monday of your vaccinating process, is a challenging time. But you are passionate enough about what you do and your willingness to share it that you made time to do this with us, and I just really appreciate you both, and want to thank you for your time. And barring anything else, I think that we have pretty well covered this information. But again, anyone listening to this who wants to be connected, who would like some more information, please reach out to us. My email is kkendrick@tha.org. kkendrick@tha.org. I'll be happy to make a connection for you. And so proud to see what Texas hospitals are doing across this state to protect their staff and care for patients. And thank you all for your time.